The purpose of this presentation is to introduce the Resuscitation app and determine its usefulness for nurses. Resuscitation provides simulated case studies of ill patients. It is marketed as an educational game with a hope of improving the player's overall clinical skills in the process. The role of the player is determined by the case study selected. You may be a neurologist, obstetrician, gynecologist, emergency room physician, pediatrician, or paramedic. The player examines and interviews the patient, chooses differential diagnosis, and subsequently controls which procedures, exams, medications, and tests are ordered. The player is scored based on each decision made with a final performance review at the end. Based on the test results and deliberation, a diagnosis and disposition is required to end the game. Discussion and evaluation with rationales are available when the decision is made. The free download offers 10 case studies: emergency medicine, emergency neurology, gynecology clinic, EMS paramedic, labor and delivery, and pediatric, with the in-app purchase option of over 100 additional cases. The app is designed for individual students or medical professionals who want to learn more about specific patient care and gain knowledge of disease process. The professional nurse will use this app as an educational tool. It aids the nurse to develop an understanding of rationales for the medical aspect of patient care. This includes the why, what, and when for physical examinations, tests, procedures, and doctor's orders. The app is used to enhance clinical decision-making and can be helpful during clinical training. It can also be used to enhance the medical knowledge of disease processes diagnosed within the app. A detailed discussion at the end of the case educates the nurse regarding the diagnosis. Resuscitation is user-friendly and simple to learn. The app is fully functional without an online connection. It utilizes a one-click touchscreen, a series of drop-down menus with check boxes for ordering, and also a search bar if the user has trouble finding a particular order for the patient. Navigation through each field is quick and straightforward. The results are clear and viewable immediately. The results would not be easy to understand for the layperson. The player must have a medical background to fully understand the terminology. The results of radiology tests and EKGs show the actual tests without a report from the radiologist. This can be a problem if the user isn't familiar with reading X-rays, ultrasounds, or EKGs. The web page markets resuscitation as an educational tool. The disclaimer maintains that it is only a game. The application, developed by an emergency room doctor using textbooks, medical journals, and his practice as a basis for case studies, is not peer-reviewed, has a very complex design, and cannot ensure validity. EM Gladiators takes no responsibility for any damages, financial or personal, resulting from the use of the product. The application has properly cited references and maintains it has no affiliation with any other companies or organizations. There are no studies to prove using this application will enhance true clinical skills, although that is the objective. Resuscitation is highly recommended by the presenter for students and professionals in health-related fields. It focuses on education aided by simulation technology. Simulation assists a learner in developing the high-level thinking skills of analysis, synthesis, and evaluation. In comparison to traditional simulators, the app is significantly less expensive. It is a practice-based approach to learning, utilizing the most current mobile technology available, anytime, anywhere, without worrying about having internet access. The application offers detailed, authentic case studies with rationales and feedback on correct and incorrect answers in the discussion at the end of the game. The user is able to track their progress as each case study is completed. Resuscitation is a self-learning tablet activity focused on increasing the knowledge of the player via interactive simulation. It requires clinical knowledge to utilize the app's full potential. Simulation enhances the user's problem-solving and analytical thinking. The app provides a breakdown of which actions were critical for the appropriate management of the case after choosing diagnosis and disposition. The case studies are very detailed and provide an excellent basis for patient care. Because it has not been updated since October of 2014, it may or may not represent current standards of practice. There are no major promoters attached to the program other than the developer, so there are no conflicts of interest. Any person interested in the medical aspect of patient care will find this app useful. However, without clinical knowledge, the person will not fully understand or be able to evaluate the information presented. This is a very entertaining and informative app that offers in-app purchases of many more case studies.